The Alzheimer's dementia is a form of dementia. So Alzheimer's disease is a form of dementia. Now, I give this analogy to people when we are describing dementia and Alzheimer's because it's one of the common questions that people have got doubts about. So I give the analogy of the sports. So sports. Under sports, you've got different types of sports. For example, you've got football, people call it soccer, hockey, cricket, badminton, tennis, golf, volleyball, different types of sports are there. So similarly, dementia is the umbrella term, and under that you've got many types of dementias, and Alzheimer's dementia is one of the most common forms of dementia, roughly representing about 45 to 50% of the people who are diagnosed with dementia will have an Alzheimer's dementia. So it is one type of dementia. On top, there are other types of dementia, for example, vascular dementias, the frontotemporal dementia, Parkinson's disease dementia, Lewy body dementia, and there can be a mixed Alzheimer's and vascular dementia, apart from many other types of dementia. So Alzheimer's disease is one of the types or one of the subtypes of dementias. So whenever the process of Alzheimer's disease starts, there is a bit of a prodrome, or we call that sometimes as a preclinical stage, in which the person will not show many signs, but there might be some of the symptoms like memory problems, because memory problem is one of the main symptoms of Alzheimer's disease. And this can be a starting symptom, or this can be just coming later on. But this is one of the initial signs that people start to forget things, people start to lose remembering names of people start to lose the items in their household, they might lock themselves outside, forgetting the keys inside. So these are simple things which are the initial presentations of the dementia or Alzheimer's disease. But also there might be things like change in personality. So when people bring their family members for assessment, they might say that my father or my mother is not the same person. My spouse, my wife or my husband is not the same person. So out of character presentation is also another presentation that can be in early signs as well. So there might be problems with the memory, there might be recall of information, there might be difficulties in language. So communication will be difficult. There might be issues about word finding difficulty. So you ask a question, the person will start to talk about or think about something else, and they will not be able to remember what questions you've asked, and also try to beat around the bush. So they're not able to say the word. So they'll be talking around the word. So I give an example of a pen. So if you say, what is this? And the person might say, oh, this is something long, which is used to write. It is black in ink, but they can't say pen. So these are the common early symptoms that can be present in Alzheimer's disease. So there are a number of things that can be done. So the first thing would be to identify the symptoms or identify the presence of the condition in the individual. So it can be done themselves. Some of the times patients might refer themselves to the primary care, which is a GP service, and then they get assessed with a simple test. But sometimes the family members or the relatives or the neighbors or people who are concerned or caring about the person will pick up those symptoms and signs. So we talked about the early signs and symptoms of dementia. If you are picking up those signs in an individual, then you approach the primary care services, which is the GP services, to try and get an assessment. Generally, the GPs will ask some questions, which can be very simple basic tests like GP cog or mini cog or AMTS, which is abbreviated mini mental test score. And once they have done that, there is a reason for them to refer to what is called as a memory assessment service, or any independent practice or practitioners can be referred for assessment of the Alzheimer's disease. Once those initial tests are done by the GPs sometimes also would like to rule out other conditions that might be causing the problems with the memory, attention and concentration difficulties. Things like the B12, vitamin B12, folic acid, iron deficiency, thyroid levels. So these blood tests needs to be done prior to a referral that can be made for a specialist for the assessment of dementia. Once the GPs have done that test and they found any deficit in these results, they might be able to replenish those. So for example, if there is vitamin B12 deficiency, the GPs might prescribe the vitamin B12 for the individual, and their memory symptoms or attention concentration deficit might improve, and they might not need further referral. But if there's no deficit found, the GPs generally refer to the memory assessment service or a specialist for the assessment for Alzheimer's disease. Once they are with the specialist, we will go through the history examination. We do what is called as a mental state examination that includes the appearance and behavior of the individual, general mood, thought process, the perception, difficulties, and insight. And then there might be specialized cognitive tests that can be done. One of the most common tests which are used generally in the UK is called as Addenbrook's cognitive examination. So we perform the test, and also the other tests such as the test your memory or Montreal Cognitive Assessment are the tests which are done. Once they're done, there might be a sophisticated test like an MRI head scan or a CT head scan, or in more recent times, we have been doing what is called as a PET, the positron emission tomography scan, that can be done. Once the results are back, they are matched with the history and assessment and the interview that has already gone ahead, and the assessments that have been done in terms of the cognitive tools that have been used. And a combination of that history, the assessment, the interview, and the imaging, CT, MRI, or PET scanning, the conclusion of the diagnosis of dementia is made. Once the specialist have given you the diagnosis after conclusion of their findings, there is a well pathway of dementia, which is very well recognized in the NHS, and in which there is a post-diagnostic support that happens and that is required. So once the Alzheimer's disease has been diagnosed, there is a good and a not very good news. The good news basically is there are some treatments available that can help slow down the progress of Alzheimer's disease. But obviously not very good news is that it is a diagnosis of dementia, but it is a progressive condition. Whatever you do, the Alzheimer's disease is going to progress at some point. But we talk about the medication to the patient and discuss what are the treatment options available. Generally, there are three treatments which are available, medications available, which are called as cholinesterase inhibitors, donepezil, galantamine, and rivastigmine. These medications are very useful and helpful in terms of slowing down and the progression of the disease. There is no medication as such that can stop the dementia process, but these medications help in slowing down in the mild and moderate stages of Alzheimer's disease. But unfortunately, despite giving this medication, the patients might progress on further on to develop the moderate or severe stages of dementia. And in that, we have got another medication called as memantine that can be used, which is for the severe stages. And this is an NMDA receptor antagonist. That means it helps to stop neurochemical called as glutamate by stopping it, destroying the normal or healthy neurons in the brain. And that is a different mechanism of action than what is done by the cholinesterase inhibitors. So if you've been diagnosed with, if your family member has been diagnosed with dementia, Alzheimer's disease, and you are either the spouse or the family member, the kith and kin, children, or brother or sister, it is quite a challenging situation for you to be looking after someone with dementia. One, because it's a progressive condition, and the other one is it can have some of the presentation called as non-cognitive symptoms of dementia. We are aware of the cognitive symptoms of dementia, such as things like language disturbances, the memory problem, the recall of information, learning new information, executive skills, activities of daily living impairment. They can all be supported. But then you've got non-cognitive symptoms such as the behavioral problems of dementia, such as agitation, aggression. Sometimes people might be hallucinating. Sometimes they'll develop suspiciousness, paranoid thoughts, or delusional beliefs. In that, it becomes quite challenging for the individual who are living with the patient with dementia. So for the cognitive symptoms of dementia, where there is a memory problems, you can be playing a supportive role. For example, when they are able to do their day-to-day household, you must allow them to continue the household on a day-to-day basis. For example, somebody's wanting to put the clothes in the washing line, you should be supporting them. Somebody is able to make tea and coffee, you should be supporting them with that. But if there are more risky situations, such as cooking the meal, for example, and there is a use of the gas in the stove, and you're not very sure that the person is quite capable of using it, then you have to take that into consideration before giving them the full access to that. So in many ways, you can try and help and support. You can allow them to use their skills, what they have got. For example, there is something called as a cognitive stimulation. It is very important that the persons with dementia are supported with things like crosswords, Sudoku, puzzles. If they are interested in those type of things, you must support them using those things, because that'll be helpful in stimulating their brains and helpful in long-term cognitions for them. People who are living with dementia patients also get sometimes what is called as a carer burden, and you have to be aware of that. And when especially the behavioral and psychological symptoms of dementia starts, it might be a time when you might have to get some extra help. So apart from you providing that help and support, which you generally do, you might also be asking for help from your primary care, from your GPs, or also from the specialist services, who might have specialist teams and specialist nurses and psychology and occupational therapists who will be able to provide that input and support. On top, within the National Health Service, there are agencies such as the Admiral nurses, which are there in many areas, and they provide input and support for people with dementia, and also care for the carers of dementia patients. So there are a number of things that people can do if you're on the trajectory of the Alzheimer's disease, or you're anticipating that assessment is happening for you, and you're anticipating that there might be an Alzheimer's disease in a family member or yourself. One of the basic things that you can do is changing the lifestyle. If, for example, if you are having obesity, or if you've got a hypertension, a high blood pressure, or you suffer from diabetes, or you have a high cholesterol level, all these things can be monitored and managed well at the primary care level. So you might be speaking to your doctors, to your GP, to see whether these can be helped. So for example, if your blood pressure is not controlled, then some medication can be given to control that blood pressure. If your diabetes is not under control, you can check with the doctors to see whether they can do some changes to your medication so that your diabetes is within control. And also the other things like a general healthy lifestyle. So what you eat basically is very important. So how you change your diet and dietary habits, less cholesterol, less fatty food, and more vegetables and more greens to be added in your food, and healthy lifestyle choices. For example, exercise, going out for a gym, doing a brisk walk or a treadmill, and these type of keeping yourself active, these type of activities will be helpful in reducing the risk. Obviously, if somebody is on the pathway to develop that because of the genetic reason or hereditary causes, then it's very difficult to avoid not having the diagnosis. But then lifestyle modification and changes are very important for the brain health in general, and that will be helpful in reducing the progression with which the dementia will, or the Alzheimer's disease will progress.